This is another episode of the Blossom Podcast, your number one source for everything bariatric surgery, from pre-op to post-op. Registered dietitian Alex Conception gives you real, raw tips and motivation through your journey. This is the Blossom Podcast.
All right, welcome back to the Blossom Podcast. We are here again with the better voice of the Blossom Podcast, Catherine Kyle. Say what's up.
Oh, I'm happy to be here again, right by my buddy Alex. Here we go with an awesome guest today.
Yes, I'm so excited to introduce our next guest, success patient, and of course, all the questions you want to know leading up to and what it takes to achieve what this person has achieved. Catherine, introduce our guest.
I'm so excited to have a patient on. We've had a couple before, and this patient for me is incredibly, first of all, successful, but not only that, inspiring and kind of jokes and isn't so serious with herself, which is awesome. You got to follow her on social media. We'll give you the plug here in a second. Our patient is Lindsay. Lindsay had her surgery February 12th, 2020. So we're over a year out at this point. And I just can't wait to dig into some of these questions, talk about what's made her successful, the challenges and the unexpected.
Yes. Lindsay, how are you doing?
Hi, good. Thank you so much for having me here. I'm excited to be with the dynamic duo.
Yeah, welcome to the Blossom Podcast. And as you can see,
thank you.
We're actually doing a Zoom right now, so you won't be able to see us, but we can see her where she's at, and hopefully it kind of brings back memories sitting right here in my office.
That's right. Tell us a little bit about what really want to start really is give us your stats, height, including height, weight, current weight, and where you started. Like, give us all those stats that people want to know about.
Yeah, let's paint that picture first.
Yeah,
sure. Well, probably the most important one is I'm 5'11", which is ginormous for a lady. So, when people compare themselves to me, when people compare themselves to me, I'm like, hey, I'm almost 6 feet tall. So keep that in mind. And they're like, oh, that's a big difference. So I'm 5'11". I started out at 322.8, and that was the day I started the pre-op diet. Before then, I don't know if I was higher than that because honestly, I just had checked out and was like, I don't even want to know. It's too much. So the 2-week pre-op diet was 322.8. 2 weeks later, day of surgery, 311.5. And today, so I'm 3 days past 14 months post-op. I am 175.8.
Wow.
So I've lost 147 pounds. Yeah,
so it's amazing no matter what height you are.
Yeah, no kidding. Wow. But it does put it into perspective. The height is important to consider because someone who is 6-10 inches shorter than you, their goal weight might be a little bit different.
And that actually ties into the frustration in the beginning, when we compare ourselves to somebody else, like, well, this person lost 20 pounds, 30, 40, 50 pounds when I only lost 10. There's no comparison. How tall was that person, or where was the
right,
or what is their
or their age too?
What's their age exactly? Or is that a man or a woman? There's so many different things to consider.
A lot of variables. And can
that's the other thing.
Good question.
Yeah,
what is
the
your
other
age?
thing I didn't tell you how old I am. I'm 42.
No way.
I know, that was my reaction when I asked her.
Way.
It's like, you better stop looking all young.
No way. By the way, she looks like she's 32.
Yeah, that's true.
Oh, thank
she
you
looks
guys.
like she's 32.
That's right.
I love
appreciate
that.
Tell us a little bit, Lindsay, about kind of your struggles with weight, leading up to considering weight loss surgery. But I'd love to hear, are you one who struggled with this since you're adolescent? Is this something that happened later in life? But tell us a little bit about your struggles.
Yeah, I think unlike a lot of patients that go through bariatric surgery, I was not an overweight child. I was not an overweight teenager. This was all kind of brought on by my choices and my decisions, and it wasn't anything that was genetic or a like PCOS or, some sort of medical issue or medication that brought on the weight gain. It was honestly in college, I met my ex-husband and he ate very differently than me. He grew up in rural Iowa, and like when they made tacos, they fried the tortilla shells. I'm like, what is this? This is amazing. And I didn't know you could eat like that. And so I started eating like that. And he's a man who is 6'2", so obviously could eat more than me. And I tried to keep up, and I did. And I gained a lot of weight.
Yeah.
And, it sounds very simple to just attribute it to that I started eating more, but I really needed to examine my relationship with food because I was using it as an emotional crutch, not dealing with my issues and using food to make me feel better or comfort or in times of sadness. And, a lot of my last relationship was a lot of sadness. So I was eating all the time. And
that's what
so
happens
I think
for a lot of people too.
Yeah.
Right. When it comes to just coping and building that crutch and building that relationship with food, that toxic relationship with food, especially
right.
I don't know where you live, but if there's a lot of activities to do, but for a lot of people, we just eat. Even when it comes to dating in the beginning, it's just eating.
Yeah. I live in Minnesota, so we hibernate for like 6 months of the year. And, I wish we could be hibernating right now too. I don't know if you guys have been watching the news. There's some stuff going on, but it's a little stressful in Minnesota. So it's a very easy time to continue dealing with emotions through food. And so I'm very glad that I've gone through this at the exact time that I did. I mean, it just kind of worked out perfectly. Yeah. And then I was able to do this without being under the eye of everyone watching me lose weight. I basically was at home, and then I emerged, like a butterfly. I'm like, hey guys, look at me. And they're like, what?
Yes. You blossomed into that flower.
New year, who it is.
So let me ask you this. So you explained that it was kind of a culmination of a relationship, your personal relationship and also your relationship with food. And how long ago was that? And how long do you feel you struggled with that? And at what point did you think, okay, weight loss surgery might be the solution for me?
Yeah. I started gaining weight steadily, probably at age 20. So I was still in college. And then when I got pregnant at age 29, I gained 80 pounds. So that put on a lot. And then after pregnancy, I lost 50 of it, but I still had those additional 30 pounds. And it just kind of like every year just kept getting more and more until and I would start some sort of diet program. So like I made a list of everything that I did, and it was, total body makeover, Weight Watchers, LA weight loss, MetaFast. MetaFast I was pretty successful on. I lost 80 pounds, but then I went off of it and I gained it all back plus another 30 pounds. And then after that, I did keto and I lost 50 pounds, but then I stopped doing keto and that came back. And what I didn't do was address my relationship with food during any of those periods of restriction. And I think that that's probably been the biggest key to my success is before I even started looking at weight loss surgery, I looked into an eating disorder therapy program. And I found one here in the Twin Cities. There's two main healthcare ones that are pretty well known. I chose one of them and was diagnosed with an eating disorder, OSFED, which is short for other specified feeding and eating disorder. So it's basically you have symptoms from anorexia, you have symptoms from bulimia, or you could have symptoms of binge eating, but you don't fit all of the criteria for diagnosis for that. So like anorexia, I was 322 pounds. Nobody's going to diagnose me as anorexic at 322 pounds, but I did have a lot of restrictive behaviors and followed by binging. So it was just, addressing that cycle.
I'm sure a lot of people can relate to that.
Absolutely.
Yeah.
Because it's not just yo-yo dieting, right? It's not just yo-yo dieting. There's actually, you have to address that relationship. Why am I doing this? And at least talk it out. Sometimes some people need to hear that, hey, it's okay. You're not weak if you want to talk, sometimes it will actually help, especially in your case too, that people may not realize is grasping that reason and how did I get here, and it wasn't this heavy before, it doesn't make any sense, and now you're just like jumping from one diet to the next, and now it's just on top of that, considering your metabolic adaptation and what changes from your metabolism. And that's also why this tool is so helpful and so beneficial to put a cap, right? Put a cap on things, because even if you fall off, and I say this all the time, that this tool doesn't change your relationship with food overnight.
No.
But
I don't think it changes your relationship with food at all if you deal with it.
At all. Yeah, you have to deal. And that's how you can also gain the weight back as well.
Yeah.
So that's where I say we are also human and we will have moments of weakness, but this tool will stop you after 3 or 4 bites, especially in the beginning, while you figure this out mentally.
Right.
And also, you can also push through that. Like, you can push to the point of even the tool is restricting, but your mind is so strong, you can say, whatever the case is, you're going through something, you're having a bad day, and you used to go back to, like you said in your scenario, eating and or binging. And the tool's not going to stop you. It's going to make you uncomfortable, but it's not like it literally closes your mouth and your throat and your stomach. You can push it.
And the food choices are going to be the biggest.
You could choose to eat a bag of chips and eat the whole thing, or
eat fried Oreos
and be just as full.
Yeah. And people are like, why does that go down so easy compared to eating like a piece of chicken and asparagus? Do you think, Lindsay, that it's fair to say that you would not be as successful as you have been without addressing the mental side?
Absolutely. I've learned so much over this past year and a half of doing therapy, and it's been invaluable in this process. Because it's, when people ask me now what I've done, I say that it was part of a 4-pronged approach. I addressed my eating issues and my behaviors, still working on it. I'm not recovered by any means, but working on recovery. Second would be the VSG tool. Third is I completely changed how I eat, focusing on protein and veggies first. And then 4, getting an activity. Those were things that I was not doing before, and I'm doing all 4. So it's not like one thing is what made me successful. I think it's the combination of all 4.
And also knowing that, or making it a priority, makes it so much better too. Because a lot of people, I don't have time to do this, I don't have time to do that, I need your help, I'm asking you to write down your, what you're eating. It's like, I'm busy. It's like, well, then it's not a priority, and how am I supposed to help you? Being able to put that first as well, yourself first, right?
Yep.
Were you an athlete or anything like that prior to college?
Yeah, I was. I played soccer for 12 years.
Wow.
Grew up very athletic. My dad, played college basketball, so he's very athletic, 6'5". Came from an athletic family. And so that was something that was very hard for me to become inactive, and just struggle to go up and down stairs. I literally felt like I was wearing a suit for 25 years and that the real me was underneath.
Wow.
And that I've just slowly been melting. And I've always felt like this shape and size, but my exterior did not reflect what my inside really felt like.
So it was good to find that person again, right? That pre-college athlete. I see on the social media, you're posting up the activities, and I love that you share that, because a lot of people do want to see it, and they're not alone.
The honesty from you, both you and our mutual friend Fiona, the Wobble Wednesday or the Wiggle Wednesday, or you guys, I just love that honesty, because it's like, Alex and I talk about this all the time, and social media and the culture that we live in right now, we are constantly comparing ourselves to one another in such a very toxic way.
So toxic.
So sad. And that's it. I'm scrolling my feed, and we're just we are impressed upon all the time and conditioned to get perfect and do this, and you're, until you have loose skin, oh, there's a fix for that. It's like, and you know what? There's people who do skin surgery or any of those procedures after weight loss surgery, and that's amazing. And please do it. If people think that that's what they want for themselves, please do it. But I also, on the other side, it's like, you don't have to do that in order to be healthy on the inside. And I think that's what's super important to understand is, first of all, by looking at someone, you can't determine their health.
Yeah.
No.
You could be an athlete and
you could be skinny and unhealthy.
Correct.
And I was 323 pounds and I had no other medical issues. I had no high cholesterol, no high blood pressure, nothing, no diabetes, no pre-diabetic. But people would look at me and be like, "Ooh, you are unhealthy because you are fat."
You better be careful, right?
Yeah.
And
it's that judgment based on how people look. It's just toxic. It's sad,
so
really.
being and reflecting on what's going to make you happy, what's, whether it's children, whether you're not able to play with your kids, whether, it's like, because you can, we're not saying that you need to be a certain way, but it's also still being healthy and happy, and I like to say not at risk for chronic illness related to weight.
Right.
And that's my goal for everybody, is happy, healthy, and not at risk for chronic illness related to weight. So anytime somebody says like, what's my goal weight? It's like, I don't know what your goal weight is. How can I give you? I can give you maybe a platform and a blueprint to help you and some milestones along the way. But through this journey, you have to determine what's going to make you happy, because I can't. It's still going to be frustrating if I give you a number and you are confident, happy, and healthy. 10 pounds heavier than I said. You're still going to be miserable until you hit that 10 pounds. You're going to struggle and maybe do something unhealthy to hit that number.
And the other thing to remember is your goals throughout this process can and will change. So if you are just holding on to this number and, but you're doing measurements too, and maybe the number on the scale is not what you wanted, but you're doing measurements or feeling better or more mobile, like that's the thing. The number on the scale you can get hung up on. And it actually brings me to a question for you that you've talked about a lot over the past couple of weeks on your socials is Dr. Matt did give you a goal weight, which all of the doctors don't. It's depending on the patient and the surgeon and the dietitian. But he did give you a goal of, was it 175?
It was 180 to 185.
Interesting. So you've surpassed it. And I remember you saying that you had like no even thought in your mind that this would be possible. So walk us through that kind of, your thought process there and why you think and how you think you reached that goal.
Yeah. I mean, I'm completely shocked that I joke about it, but I also am kind of serious that I didn't know that it was possible to lose 100% of your excess weight. Because like all the research out there, everything that, is on Google, it says, VSG, you can expect to lose, 60% of your excess weight, and the Roux-en-Y bypass can be 70% of your excess weight, 70 to 80%. So, even with the bypass, which is, a dual method of weight loss, you still, they're saying on average, this is what it is. And I can't tell you how many times I Googled, what is the percentage of patients that lose 100% of their weight? And there is nothing out there that has that information.
There's even a lot of factors are the very unsuccessful ones. It's like kind of messes up the curve too. And not only that, it's the amount of work that every individual puts into it. So I like to say this is not an absolute solution, but we can give you an idea. If you laid on the couch all day long, I don't know if you recall the metabolic, if you laid on the couch all day long, this is something that you can possibly, because I don't know what you're going to do, after surgery. I can always motivate and tell you, but I'll give you the least amount possible because I don't want you to have an unrealistic expectation, and then we still Google and compare and everything.
I know. Well, and I will say that, the reason why Dr. Matt gave me a goal is because I asked him point blank, it was kind of like, he's not escaping this. So
Yeah.
I think that, but it makes sense to not tell patients, hey, this is where I think you can get, because it's super easy to fixate on that. And I do remember getting that 6-month weight loss goal and being so paranoid that if I didn't hit that I was not going to be successful. And I'm here to tell you that my goal that I think I got from you, Alex, was 80 pounds by 6 months.
Mm-hmm.
And I got to 78 pounds. So
Oh, wow.
it was pretty close, but
pretty close.
not exactly, I didn't hit it or go over it. And still, even still
Yeah.
at that point, I was like, oh my gosh,
Were
am I
you
going to be
upset?
successful? Am I going to do this? I was worried. Yeah.
Mm.
Because I was like, man, they said 6 months, do everything
did you
possible.
call me up, or did you reach out at that point?
No. I mean,
So
because I was so
I
close.
will encourage people that if you are feeling that way, voice your opinion, because obviously you're happy now. You've maintained, you did well. If anything, I like that you were right under, because it kind of still lit that fire,
Yep.
and kept that fire to say, man, I gotta push through.
Totally.
But I don't want anybody to think that, oh, I didn't hit it.
This is it.
This
Yeah,
is
then
it.
they
I'm
give up.
done.
Yeah, call, email Alex, email the
Yeah.
nutrition email, because Alex will put things into perspective. Because think about this. Could you imagine gaining 78 pounds in 6 months?
Ugh, that would be a nightmare.
Right. And you would feel like, oh my gosh, I can't believe this. And so I think it's like keeping things into perspective. And we always tell people part of the Blossom commitment is a minimum of 10 pounds a month for the first 6 months. So you were 28 pounds over that minimum goal. So I think, and then even this next 6 months, you really maximized and essentially doubled that number.
Yeah.
Yeah. Which is insane. I don't know. I mean, people ask all the time. They're like, how did you do it? What did you do? And I don't know. If you go to my social media, you'll notice I don't really post what I eat, because I feel like that is, part of my eating disorder is I get triggered easily by seeing what other people are eating. And then I question, like, oh gosh, am I doing this right? Is it, and I'm trying to not demonize certain foods. I've been learning how it's not healthy or unhealthy foods. It's nutrient dense or energy rich foods. And they both have places in your diet, even when you're on this weight loss journey. People are so scared of carbs, but you need carbs. Your body needs carbs.
Exactly.
And yes, we set a limit, to kind of give a guideline, but again,
even in these first 6 months, what we teach and what we do is to build a foundation for long-term success.
Right.
We do the sleeve, the magic window is 6 months. Okay. And that is because you will never get this time back, and it will never be this restrictive again. So don't squander it. And we are in this time, we are learning, and then we can start introducing the foods again, because I don't want to, and that's basically the bottom line of the foundation and the pillars of why we do it that way, is so you can be successful down the line, but also maximize the potential of the sleeve in the time that's most valuable. And I always say too that we're creating balance, because I'm an advocate for balance. I don't like to demonize fruit. I don't like to demonize carbohydrates. I don't even like to eliminate entire food groups. But if you knew how to balance, you wouldn't be here.
Correct.
So we are, and then we, again, just like as you've done, you've started incorporating, and now you know as well, there's the nutrient dense and the energy rich. It's a lot of factors into play, and to still be happy.
Yep. And I know a lot of people go on Instagram to compare and make sure that they are, doing things correctly and they're on their own journey. But, I'm on my journey, and what my journey looks like could be very different from yours. And I can't tell you how many people have reached out to me and they're like, I've only lost such and such amount of weight in 4 months. I'm a slow loser. I'm like, when's the last time you lost 50 pounds in 4 months?
Right, exactly.
And it's so easy to just get caught up in that and compare, especially on social media. Instagram is kind of known for, you pick that one perfect picture to put up there. And
Takes
what people
100
are
photos.
they're curating their content to show their best self. And I kind of made a decision to be like, you know what? I am not perfect. This whole journey is imperfect, and I'm going to experience setbacks. I'm going to experience mental struggles, body dysmorphia. There were days after I'd lost 70 pounds where I felt fatter than I had before I even started the journey. Just because of how loose I was with my skin, and like, there's still weight in there, so it swings and stuff. So it's so mental. But like, I think that that's part of why I really felt like I needed to be so open on social media, is because I was not seeing those experiences out there. And I felt like, people needed to know what maybe a different option looks like, what it looks like for someone else.
We appreciate it. And I'm sure the community appreciates it too. So tell us about how you found Blossom. What led up to finding and choosing us?
Yeah, so I actually looked into weight loss surgery, I think in 2013. And I went so far as to like go to a seminar at a hospital and get literature and them talking about, okay, let's get you signed up. And then I chickened out. And I didn't do it. How
far did you get in that process in 2013?
Just the seminar and all of the pamphlets and brochures and stuff. And then I was like, oh goodness, this is a lot. And then I think it was in 2019. I again was just kind of back up to the super high weight after having lost a whole bunch of weight. And I was like, oh my gosh, is this going to be my whole life? Am I going to lose a massive amount of weight successfully doing some sort of restrictive program and then gain it all back plus 20, 30 pounds? Because, that's your body's biology. You can't fight it. So I think I just had hit enough. I just was feeling crummy. My knees hurt. My back was in pain all the time. I have 2 herniated discs. So I was uncomfortable, and my asthma was really bad. And since that's one thing I didn't mention as far as health, my asthma is basically non-existent now, which is amazing because I've had it since I was 2. So it's basically just exercise induced now. So that's amazing. But yeah, I think I started by looking at a couple of Facebook groups, and I joined one that was like, I got sleeved in Mexico, because at the time I didn't have health insurance. And so, I wasn't going to be able to go that route. And so I was like, well, okay, how does this look as far as self-pay goes? Mexico is cheap. I hear about that. And then I started looking into it, and then I got really freaked out. I got really nervous because it's a big surgery. It's a really big surgery. And I'm not saying that there's not excellent surgeons outside of the United States, but I just was worried about, I have 3 kids, a husband, and if something were to happen in another country, how difficult would it be to get medical help? What about what if they had to repatriate my body? I don't know. So it just was really scary. And so in that Facebook group, I saw somebody mention Blossom Bariatrics and said, hey, here's an alternative to Mexico. If you want to stay in the US, they've got this medical tourism thing down pat. Take a look. And so I started to look at it, and I was like, oh, well, this sounds amazing. And then I set up a call and talked with Nick, my care coordinator.
Nick's a manager now.
Yeah.
Nick is
for him.
He's done
he is amazing and has gone through it himself. Yeah. And then from there I called, and it was kind of one of those moments where, since you're self-pay, you can get scheduled really quickly. And I actually was offered a date that was something like a month and a half from the day I called, and I wasn't ready. I was like, oh my gosh, that's too soon. I can't. So I actually pushed it out probably 4 months by my choice. Because I called in November, and then I ended up having surgery in February. So I just needed a little bit of time. I think more so because I just kind of started that eating disorder therapy in October. So I kind of wanted to get my head straight. Before I actually went through it.
Fantastic.
And then since then, speaking of Facebook groups, I've left all bariatric Facebook groups with the exception of the Blossom one, because this is the one that is the most supportive, the most informative, and not toxic that I found anywhere. And it's amazing to have people who literally went through the exact same thing with you with the exact same doctor.
Yeah.
Just to have that community. It's so rich to have that, and it's amazing.
And that's exactly why we keep that group private and exclusive. And we've had a lot of people say, open up the group to, I'm scheduled right now, but not for 3 months. Can I be in the group? Or I've even had people inside the group say, you should open this up for pre-op people because it'd be so helpful. And yeah, it would be helpful, but
it can also turn a little toxic as well.
it turned a little toxic. And honestly, some of this stuff might somebody who's in the pre-op phase might see it and it might freak them out because they're again comparing themselves to somebody else. And it's like,
yeah, I don't want to feel that.
Yeah, it doesn't happen to everybody, but it's interesting you mentioned that the other Facebook groups, because I'm in multiple. Some of these groups have 150, 180,000 people in them. And yeah, it's pretty wild on there, man.
Mean.
They're mean.
They
and
are mean.
It's like the opposite of the word support. It is just.
And that's what I tell people too. Is like, there are a lot of people who do this alone, who don't have support from their family, who don't have support from their spouse, who don't have, or even not even telling their family at all, that they're doing this. So it's very difficult to stay on track because whatever is keeping you where you are, those people are still going to be there, and it's going to be, and they're still going to offer you whatever, and they have to have an excuse or what have you, but they're alone. And being able to jump into the support group with everybody in there who's gone through it, it's really, really awesome, I think. And I also say that we do things different as well.
Yeah.
So our rules are a little bit different, and we try to get that continued support, and it's fantastic. I think it's done more good than bad.
Yeah, we have 2,300 people in there right now, which is wild.
Wow.
We started that group in January 2018, having no idea what would happen. And again, with the mindset of like, let's do it for post-op only, because I think the mentality of somebody who's pre-op just researching is one mentality. Then there's a mentality of, okay, now I'm scheduled. That's another mentality. Now I'm on my pre-op diet. I'm 2 weeks in advance, whole nother mentality. Then you go into the post-op and it's completely different than anything that you thought you knew or you felt before. So tell us, is there something that you wish you would have known in that pre-op phase, maybe that you know now, or that something that was surprising or you didn't realize?
What would you tell yourself?
Yeah.
What would you tell yourself now to the pre-op version of Lindsay?
I would tell myself, you can do this. Have faith in yourself. Just giving that confidence to myself, because there were so many times where I questioned what I was doing. Am I doing this right? Am I losing fast enough? Am I eating the right things? And it's so easy to say now in retrospect, just trust the process. Just trust it.
Say that. Trust the process.
Especially, like everyone is going to get a stall. Everyone is going to hit a stall at some point. I mean, your body is going through this huge, crazy change. Of course, it's going to freak out and be like, what are we doing? Are we starving to death? We need to stop because you are dying. Yeah. I mean, I know it's not really what's happening, but, your body needs a moment. And sometimes, a stall can be 3 days, 3 weeks, 3 months. I've seen people who've had month-long stalls, and then all of a sudden they start losing again just because they stayed the course.
Yeah, adapting, adjusting, and your metabolic rate. Yeah, your body wants to. Yeah, it's like, come on, what is this?
Yeah,
it's only been X amount of months, but compared to how many years you lived a certain way, that's like a perspective as well.
And I would say that, I was one of those people that was very private in the beginning. I only told, my husband and my mom. That was it.
Wow.
I didn't even tell my kids. I told them that I was getting hiatal hernia repair and that we were going to Vegas because it was cheaper because we had no insurance. And then it was until, I think like 3 or 4 months later that I finally started telling people that were, close to me and kind of noticing. But again, we were in a pandemic, so I really wasn't spending too much time with a lot of other people. So I had that benefit of being able to do this not under scrutiny of others. So that was something that really was unique and beneficial to my journey, at least for me. I know that was something that I appreciated. And now that I'm to the point where I was like, oh, I'm successful. I did this and I'm still, doing okay. I am now totally comfortable telling everyone about this because
that's awesome.
I feel amazing. And I want other people who were feeling like me before to also feel amazing, because it can be done. And so I think that's something that I probably would have said to myself before surgery or in retrospect.
Yeah. Trust the process.
Trust the process. It'll be fine.
What are you doing now in terms of the regimen for your eating and the activities, workouts, things like that?
Yeah. So
Actually, before you answer that, what is the goal right now? Is it maintenance or is there continued weight loss?
My goal is maintenance, but I'm still losing. And my body shape is changing a lot because I am lifting and I'm also doing Pilates. So
I can tell.
Yeah.
Girl.
No
thank
doubt.
you. So my body composition is changing.
That
no
Pilates
joke.
is,
No joke.
You know what?
And it's
so
a combination of the two.
Yeah. I pulled up like a 20-minute Pilates video on YouTube. I'm like, Pilates for beginners. Let me see what this is all about. I could not believe it seems like you're doing nothing. And the next day I was like,
it looks so serene.
And my butts has never felt like this before.
Yes.
So I like that because it's low impact and it's actually like kind of relaxing, and it's like the breathing and it's taking things slow instead of like going in and hitting the gym. Let me see how hard and heavy and fast I can
It's
go.
not hardcore.
Yeah. So tell us.
Yeah, tell us, what's the regimen look like?
So I didn't exercise for probably the first 6 months other than just walking outside.
We were on a pandemic. Everything was closed too, right?
True story there. So I really didn't do anything. And then at 6 months, I started trying to lift, and my nutrition just was not there to support lifting at that point. I still was having a hard time getting in all my protein and getting in all of my calories and getting in all of my fluids. It took me kind of a long time to get to that point where I could get everything in. I would say it's probably between 10 and 12 months for me that I am now like hitting those goals every single day. But I was just going to say, Alex, one thing that you may have noticed, I don't know, in preparation for today, if you went into looking very-tastic, but I don't track any of my food anymore. And that's because of my eating disorder recovery. And I did it in the beginning, which was great because it really opened my eyes to what the caloric content was of things, how much protein. And so I kind of knew, okay, today I feel like I need some cottage cheese but I also want some fruit. And so I'm really learning how to eat intuitively. So there are some days where I'm like, oh my gosh, I am ravenous all day. And I just like eat and eat and eat and eat and eat. And I don't punish myself for that because I'm not eating chips. I'm not eating licorice. I'm not, I am
habits.
Right. I am eating more carbs than, were at 6 months. But again, it's because I'm 14 months out. And
it's balanced. It's not like you're getting 90% carbohydrates. It's still balanced, and you're still prioritizing the protein and the vegetables and things like that as well.
Right. Yeah. Right. And then I would say so I started at 6 months with exercising, and then I had to pull back, and then I started again in November. So that was probably 10 months post-op. And that's when I got a personal trainer. And she set up a program where we were going to work out 3 times a week. What I found now is even still, that's sometimes a little bit too much for me, because I kind of get back into that triggered process of like, oh gosh, I didn't work out. You're a bad person. And then I'm like, no, stop it. You're not a bad person. Yeah. That is your eating disorder talking to you. And if you only work out once this week, that's one more time than you were doing 2 years ago. And so I've really tried to learn how to have grace with myself and just know that, if you don't do everything every single day for your entire life, you're not going to fail. It's okay to, take a week off, go on vacation or
Yeah,
whatever. And then you just kind of get back into it. And
we have
so
to do
now,
more good than bad in
yeah,
the balance of things, right? That's why I say
yep,
we
yep.
want to create balance.
So now what I do is I do one lifting virtual training session with my personal trainer. She gets me that program for the day, and then I repeat that same workout 2 more times until I see her again the next week. But if it's a week where I'm doing Pilates, I'll do that 1 day a week. So I'll do 2 lifting, 1 Pilates, and I'll alternate. Sometimes I only lift once a week. Sometimes I only do Pilates once a week. It's
Maintaining
just,
calories, the good food, and then
yeah,
activity. Just in general, activity is what we want, right? Otherwise, it's not being
yeah.
lazy, sitting on
Yeah.
the couch
Move your
doing
body
move
some
your
way.
body, and
Which the winter was tough. Woo, let me tell
Oh, I
you.
bet.
Especially during this pandemic in
oh,
Minnesota, it was so depressing. So I had to get a treadmill and just walk and just, it's hard to be motivated. You don't have intrinsic motivation.
mm-hmm.
You have to make that choice. And sometimes it's really hard to make that choice.
Mm.
Yeah, no,
But the more you do it,
100%.
the better you feel.
And that's where it is good to have like a workout buddy, or even on Instagram, like having somebody like you to see post. It's like, yeah, I should too. It's like, man, what did I do today or yesterday or the day before? It's like, I think I could. I think I should get up and maybe do something right now. So at least seeing that too, it can be positive, and within the group too. We did do that, the challenge in the Facebook group as well, right?
Yeah.
To get people up and moving, and
Active.
get active.
Which is great.
So, yeah, definitely during the pandemic, because a lot of us didn't have gyms. So we don't all have gyms in the
Right?
house, or hardly anything. So being able to let you know that, hey, it's okay. We can still get active, get that blood flow, and you can still
Yeah.
make success. Because we're talking to somebody who didn't work out for 6 months, for the first 6 months, and still was able to hit those numbers. That actually now makes more sense. It actually makes it even more accurate, that metabolic interpretation, for you to have not been working out and then
Yeah.
still be right at where we were putting you at as a realistic expectation for
Yeah.
weight loss. So that's really good to know.
Now
Yep.
going back to your the mental health side of things and your eating disorder, your therapy, where does that fit in now? How often do you talk to, and is it a therapist? Is it someone you
Mhm.
see in person? Do you go to groups? And how does that fit into your weekly, monthly routine?
Sure. It is virtual right now, again, because of the pandemic. And so we do video chat. And I probably see my therapist every 2 to 3 weeks. So at the beginning, it was every week.
Mm-hmm.
And it was pretty intensive at the beginning. And I also had a nutritionist that I had when I started. But then once I transitioned to Blossom, the nutritionist was like, okay, I'm not going to help you anymore because you have a nutritionist now that you can talk to that is specific to this kind of surgery. And in eating disorder world, they're not big proponents of bariatric surgery. They're not very encouraging for people to do that. So they were like, see ya, good luck. But I'm still doing therapy, and yeah, it's every other week or every 3 weeks. And yeah, it's been instrumental in this whole thing. So
Good.
what else was your other question? Sorry.
No, that was it. I mean,
Okay.
do you foresee any point in the future where that's not part of your routine or part of your life?
Yeah, I do. I do, because I feel like I've learned so much, and I'm actually at the point now where I'm considering going to like once a month or once every other month, because like I'm so grown and I know so much now. I've learned everything, which, my therapist was like, yeah, good job, Lindsay. See you next week. so, but yeah, I mean, I think that like in the beginning, when you're going through that, oh my gosh, I completely have changed everything about my life. It's a struggle to figure out how to feel about that. And so I feel like it was imperative for me to have that mental support for sure the first 6 months of this journey, and just to get that baseline.
Good.
Yeah, absolutely. So wrapping up here, it's been amazing talking to you. I just absolutely love your vibe. I'm just like, I want to
Yeah.
be friends in real life, man.
Aw.
Like,
Yeah.
I'm like, I don't even want to DM anymore. I don't want to
Do a
TM.
Pilates
I want to
class.
text.
We
message.
are
Yeah,
friends
let's
in
do a
real
virtual
life.
Pilates class. No, but tell us, like, just in closing, first of all, was there anything else you wanted to say? And then secondly, what would you tell somebody if we haven't touched on it already? I mean, it sounds like you said a few things, like address the mental side of things, have faith in yourself,
Trust the process.
trust the process. What else would you tell somebody considering this surgery?
I would say, obviously examine that mental part and be prepared to change everything. That sounds really intimidating and scary going into it. You're like, oh, I don't want to change everything. I want to eat cake. I want to eat pizza. Well, guess what? You can, eventually, but not as much as you were before.
Right.
And not at the level. But I think that, really paying attention to what your reason for why you've gained your weight is going to be it's going to be key to kind of address that and be successful. I have had a lot of people reach out to me that I know personally that have asked me about it, and now they're actually coming to Blossom. There's like 3 people that are coming soon, and it's all because I was willing to share my journey, which it's an incredibly private thing, and it's okay if you don't want to share, because this is your choice, your body. But I knew that because a friend of mine shared her journey, that is what helped me take that next step. Yeah. And to know somebody that I knew personally, hey, they were successful, they did a great job, they were willing to talk to me about it. And I just kind of wanted to pay that forward, because I know what it's like to struggle. I know what it's like to feel bad about the body you're in. I know what it's like to sit on the sidelines and watch your kids running, and you're just sitting there watching, and it's not fun. And your kids are with you for like 5 seconds of your life. And, it's just amazing to be able to participate again in life, and just be a part of that.
I love it. That is so awesome. And yeah, it was so great to talk to, catch up. It's been like 14 months.
Yeah.
Right?
Yeah.
So yeah,
it's
literally,
great to see you guys again.
It's like it's looking at a completely different person. I'm so happy with your success, and I'm glad that you are continuing to progress and actually inspiring people through the process.
Yeah, we'll see where I end up. I don't know what my end weight is going to be.
Don't stop. But of course, you do have continued support. If you wanna, flip the switch a little bit, change things up, let me know. Shoot me an email. Give us a call. We got your back.
Awesome.
Okay. But yeah, that's pretty much it. Let's. Where can we find you?
Yeah, give us your Instagram handle. Media.
Sure. It's Lose It Lindsay, and my name is spelled Lindsay.
Lose It Lindsay on Instagram.
Lose It Lindsay. Yep. It's open for everyone. So even if you don't want to follow me, you can just be a stalker and look at all of the pictures.
Yeah, troll.
You don't have to let me know you're looking.
Love it.
Fantastic. All right. Well, that's it. Hopefully we'll chat again soon, and we will see you guys in the next. Peace.
Thank you, guys.
This was another episode of the Blossom Podcast. For more motivation and future episodes with Alex, make sure to subscribe so you don't miss out on any life-changing moments.